Welcome back to West Texas View.
We've been talking to Dr. Bobby Jain, who is a psychiatrist with the Texas Tech Health Science Center, but also in private practice and has offices in both Midland and Odessa. But he reaches out, as he was telling us just before the break, to some of these far-flung areas in the West Texas Permian Basin area through telemedicine. And this is a fairly new thing. We've been having telemedicine for physical things for a long time, but this is fairly new in mental health.
It's very new. Let me add one more thing. I don't practice privately. I practice within the Texas Tech system.
Okay.
So just a clarification,
Yes.
minor clarification. People may misinterpret that. But we do have centers both in Midland and Odessa. And you're right. We're capitalizing on the technology. Psychiatrists are difficult to find. Psychiatrists may not be able to travel as much, particularly in rural areas. So we're trying to make a use of this new technology that we have, where in a confidential manner we can assess, see, interact kids, adults, older folks, everyone with psychiatric needs, so that we can intervene early, we can provide them the best health we can. We are trying to contract with folks all over the country to see how we can connect them to West Texas area. Because we have about 22 counties, 23 counties. Some of the counties I've heard that take up, they're 90 or maybe 100, 120 miles away. I personally have patients coming from Hobbs, New Mexico. I have patients coming from Iran, Texas, Crane. These are very far-flung areas, and mental health should be available not more than 45 minutes drive maximum. But driving 2 hours, 3 hours one way is just not, it just impedes getting adequate care. It just impedes adequate psychiatric care.
And one of the questions that came in that I thought was interesting is that a person called in who has had mental health problems within members of the family, and she specifically said Dr. Jain has never talked about how the whole family needs to be treated just because there's one member of that family that has been diagnosed. It has affected everybody.
That is an excellent question. If you're listening, please accept my thank you and my gratitude for bringing such an important topic, which we continue to neglect. We never talk about it. Let me explain how this thing works. I think it's an excellent idea. For example, someone has a family history of colon cancer, or breast cancer, for example. We ask those susceptible folks to have yearly examinations so we can catch them early and detect it and treat it early before it becomes life-threatening. So why don't the heck we do it for mental illness?
Because there's some inherited
yes,
traits,
and mental illness, just like say breast cancer or colon cancer tends to run in the family, mental illness tends to run in the family. So why the heck we don't have annual screening programs for mental illness? Well, we have been trying to start that, and so there have been some small steps into that direction. Like in health fairs and other things, we are trying to introduce some screening questions that we can ask folks to come and answer those questions, and based on the questionnaire they can actually say whether they're at risk of doing this and that, getting more help, into counseling and things like that. The problem is the stigma. I'll tell you from my own experience, having served at the booth of mental illness booth, where we are sitting there offering a time with questionnaire for people to come, and if you can see in the booth, there are diabetes booth, there are hypertension booth, there are overweight booth, and other booths are there. Guess who gets the least amount of traffic? Me. People are just not very comfortable coming and screening them.
It's much more glamorous to have blood pressure problems than it is to have memory problems.
It is. People, but I think like mental illness is like, even if you're very healthy, that doesn't mean that you're going to be healthy all the time. You can buy the most expensive car in the world, but even that car will have tires worn off, spark plugs to be changed, oil to be changed. no matter every 2,000, 200,000 miles or whatever, but it needs maintenance.
And so mental health needs prevention,
It
just
means,
like
and,
your
and,
physical.
and you use your brain, you're exposed to stresses, you're exposed to aging, you're exposed to all the things. So why the heck we don't maintain our emotional illness, emotional health? Other part of the reason is that the psychiatrists are so far in between. Our time is so much consumed by people who are already having emotional problems that our energy is drained dealing with those conditions, rather than giving advice to family members who are susceptible. At the same time, they are not having problems at the present time. From the medication point of view, for example, if your family has gotten, say, a flu, right? So if you take some precautions, whatever it is, you can prevent yourself. There's very little literature to suggest that if say my brother or my sister has suffered from depression, do I preemptively take antidepressant to prevent myself from developing depression? There's no evidence to support that. The problems and the reaction that we can get from the medications are much more than any preventive effect this medication can have. They are not shown to have any preventive effects. So medication cannot be the answer. So what can be the answer? The answer would be to understand how you think, how you interact, how you perceive things, what we call your cognition, the way you think about it. And certain known activities are known to be helpful in preventing or developing a mental illness. For example, now you cannot control all stresses. I mean, some stresses are unavoidable, but you can change your attitude towards stresses. What do I mean by that? Suppose I just happen to come to work, and in between I have a flat tire. I have an appointment sitting there are patients waiting there, I have something to do, I have a flat tire, and knowing how geeky I am, I would definitely not know how to change the tire myself. So I have to wait for someone to help, and it takes me about 2 hours to do that. Now, I have two choices. I can either sit on the roadside, curbside, and fret about it and curse the tires or whoever is the soft target is, or I can say that, this is a random occurrence. It could have happened to anybody. I had no control over it. I have done whatever I could do. And the best thing is to wait and see what happens. So if I have two choices: one, to fret over it. If I fret over it, get upset over it, my mental health will go down.
And it doesn't solve it.
It doesn't. No, the end result is the same. But if I develop an attitude of, hey, it happened, I had no control of it, big deal. What the heck?
And that's what we preach all the time, is attitude.
Attitude.
We're going to have to take a quick break. We'll be back in just a minute.
Stay tuned. West Texas View will be right back.